We just pulled in on the edge of town.
So, Bobby, you're making the first Traveller Men's Health DVD. So why are you doing it now?
I'm doing a DVD because no one's ever done one of these before that's been totally for travelling men. There's lots out there for women, there's nothing for men. And I think the three main things that we're looking at is heart, diabetes and depression need looking at because they're very, very vital to travellers' way of life.
So, in this DVD, you're going to have some travellers and you're going to have some professionals as well. So, what are we going to learn in this DVD?
What we're going to learn from this DVD is what to look out for. To look out for all these symptoms that can help you before you actually get it full term. If you can do that, you're going a long way to saving yourself a lot of problems.
We just pulled in on the edge of town. You don't know us, you want to put us down. You don't like our ways, you don't like our turn of phrase. You sure know how to show we don't belong.
Anybody watching this should know me. A lot of people will know me. I'm Bobby O'Neill. I'm 64-year-old. I'm a traveller. And we've travelled all over the country. As I said, most people know my family. And I have had some illnesses. And now I just want to talk to people about those illnesses and about how to watch for them themselves. I've suffered from depression and anxiety. I've also had a heart attack and I've had stents put in my heart. And I have diabetes that's insulin controlled. But I can't talk about all those things. People will think I'm a hypochondriac. So I wanted to talk about heart attack and the illness and the angina and what it does to you and what to look out for. Jane, can you tell me what is a heart attack?
A heart attack happens when your heart muscle is starved of oxygen-rich blood. This causes damage to the heart muscle. A heart attack is life-threatening. If you think that you or anyone else is having a heart attack, you should phone 999 for an ambulance immediately.
Okay, Bobby, so just take us through. When did you know there was a problem? How did you identify it?
I didn't until I actually had the heart attack. I had a pain in my arms and I had a pressure in my chest. You get all of these things through stress. I thought stress. Got up one morning, went off, going to work, going to do everything I'm going to do that day. And I felt terrible. When I left here, I felt awful. Got to where I wanted to be, couldn't do anything. Sat in the car, and then all of a sudden I threw up. Just can't explain the feeling that you feel. It's as if you're totally washed out. And I decided to come home, which at the time I didn't know was a stupid thing because I could have had a heart attack on the road home. But I drove back, got into the house, threw up again just before I got into the house. And as I went upstairs, I said to Anne, my wife, get an ambulance, send for an ambulance. I think I'm really ill. Paramedics were there within a few minutes and they told me that I was having a heart attack. And that was the first I knew of it, in actual sense of that. But the pain, when it came, it was unbelievable. You think of heart attacks, people tell you that it's like indigestion. You never want to have indigestion like that, believe me. That is the worst pain I've ever felt in my life. I definitely thought I was croaking. It was just like somebody's ripping my heart out. But it's in the centre of your chest as well, and it's horrible. I cannot explain what it's like. Feels like your whole chest is caving in or being ripped out. And you're out of it. You're totally away. You're miles away. You can't think straight. I still don't know exactly what happened afterwards. You know, that it's an awful thing to go through. And I wouldn't like anybody else to have to go through it, but I know they will. Jane, can you tell me what are the symptoms of a heart attack?
The symptoms of a heart attack can vary from one person to another. You may feel tightness, heaviness or pain in your chest. This may spread to your arms, neck, jaw, back or stomach. For some people the pain or tightness is severe, while others it may just feel uncomfortable. Often people can mistake this pain for indigestion. As well as having chest pain or discomfort, you may feel sweaty, lightheaded, dizzy or become short of breath. You may also feel nauseous or vomit.
When the paramedics came, they put me on an ECG machine straight away and gave me morphine. And they're waiting for an ambulance to come. They were very good. They were there in minutes, by the way. And they just took me through a lot of things that I really wasn't listening to. I was sort of, as I said, inside myself, knowing now that I thought I was dying, pure and simple. And that was about it. They were here about 20 minutes, then the ambulance came. They decided I had to go to the hospital. And it had to be bad because they put the sirens on to take me. And I was that out of it. It felt as if it only took me 5 minutes to get from here to Kingsmill. But it didn't, obviously, but it was very quick when they got me there, believe me. And then I was taken into the A&E, and they did everything that they could. They were really good to us. And x-rayed, heart attack, yes, that's what you had. Then I went put onto a ward, the assessment ward, and I had another heart attack that night, a second one. And the next morning they decided I had to have an angioplasty done, and I was taken straight down to the coronary care unit and given it. Angioplasty is when they have to put a balloon or a stent into your veins in your heart, the arteries, because one of them is blocked and you're not getting any blood or oxygen going into your heart. And that's what had happened to me. I'd had two previously, a long time ago, but this one was so fine, so small, they couldn't put a stent in. They had to put a balloon in to open it up, and the blood froze free then. And you're awake while they do it. And when he did it, I could actually feel the relief in my body, and I could feel my heart ease back to what it was. The pain went, everything was fine. And then you just have to wait for the blood to flow, to stop. And I'll never ever tell anyone not to have one. You need it. You know you're going to have one. You wouldn't care what they did to you. They could carve you up if they can stop that pain.
Okay, Bobby, now, what I would like to know is, why is this so important?
The reason this is important is because I know a lot of travellers have had the same as me, but where I got mine saved in time, they haven't, and they've died. I know some travellers, lads that I've grown up with that are now dead, that went round with pains in the chest and swore blind that it was just indigestion or heartburn. And then it was too late. They had massive heart attacks and it killed them. And I'm just hoping that anybody watching this video will realise what the symptoms are themselves. The pain in your arms, the tightness in your chest, shortness of breath, and do something about it for themselves, even if it's nothing when they get there. As I said before, stress can do it, And if it's stress, there's nothing you can do except relieve the stress. But they're very similar, and a heart attack is not like stress, it kills you. The information was given to me by the doctor, but afterwards I had to go to the hospital and talk to a rehabilitation nurse, and she is the one who gave me the most information on what had happened, what was going to happen, damage to your heart. And it's amazing what the after effects can be of a heart attack. The nurse, the rehabilitation nurse, told me that the after effects, you can have damage to your heart, and you have to exercise as much as you can. You have to change your lifestyle, more or less. Granted, I haven't that much, but I have changed some of it. And you have to then go to have x-rays done to see if any harm is done to your heart, and I know mine was damaged. I was told to start to change my lifestyle in doing a little bit more exercise, not eating as much rich food, fat food, more healthily. But believe it or not, I actually did anyway, and I still do. My cholesterol is 2.6. As big as I am, I cannot understand that. Even the doctors can't understand why I'm so low in that. And basically, it's just sort of looking after yourself. I do feel different after it. I did not want to get stressed anymore, though I don't. And I let life go by now. But at the same time, I know I was nearly dead that day. If you get this caught in time and you come through it, always remember that you can work. 7 days after having angioplasty, you can be back to graft, just like a normal person. And you're not supposed to stint yourself. If you're a healthy young man and you get that, don't worry, it doesn't matter. You can be working again within a week. And I do a little bit. I'm 64-year-old. I'm beyond that kind of thing now.
Please don't delay dialing 999 because you're uncertain or don't want to make a fuss. The sooner you can get emergency treatment, the greater your chance of survival following a heart attack.
You don't like her ways, you don't like her turn of phrase. You sure know how to show we don't belong. Move along, move along. You don't belong. Move along.
Kerry, can you tell me what diabetes is?
Diabetes is a lifelong condition, and it means that you have too much sugar in your blood. Our bodies naturally produce a hormone called insulin, and it's the insulin that helps us control how much of the sugar is turned into energy. In some people, the insulin isn't working at all, and in others it works a bit, but it needs some help to control the body's blood sugar.
Now, Kerry, can you tell me what the symptoms are for diabetes?
Symptoms of diabetes can start with things like feeling very tired all the time. You've got a tremendous thirst, wanting to drink lots and lots, going to the toilet a lot, passing urine, especially during the night if you've got to get up out of bed to do that. Another symptom can be blurred vision. You can also have problems if you cut yourself, that the wound doesn't heal very well. It takes a long time to heal. People have also complained of getting thrush a lot, so they go back, have treatment, but it keeps coming back. But if diabetes isn't diagnosed and not treated properly, then they can lead to other more complicated symptoms which involve your body's major organs like your eyes, heart, kidneys, and also your nerves. Now with your eyes, if you continuously have high levels of sugar in your blood, it can damage the nerves, very tiny nerves behind your eyes, and it can cause you to have problems with your vision. With your heart, with diabetes, again, causing damage, you're much more at risk of having a stroke, a heart attack, serious problems like that. Your kidneys, they've got tiny blood vessels in as well, and again the diabetes can damage that if it's not controlled, and you can have long problems with your kidneys. And your nerves, we have nerves everywhere in our body, responsible for everything we do, and if the nerves become damaged, early symptoms can include some numbness, some tingling. You might not feel your feet. If you stub your toe on a table or a chair or take a knock, you might not feel it, you're not as aware, and that can be a symptom and complication of the diabetes not being diagnosed and not being controlled correctly.
This here is a letter from a man who was going to be on to talk about diabetes, but when he thought about it, he was very, very ladged that he'd caused the diabetes himself through his own lifestyle. But he was quite happy for us to read this out on the DVD. He says, "I first found out there was something wrong when I was getting very thirsty all the time. No matter how much I drank, I was still thirsty. And then I was getting up through the night like 5 or 6 times to go to the toilet. And then I was feeling so tired the next day, by about 2 o'clock I could just fall asleep. Then I was reading something and the words were all blurry, so I went to get my eyes checked at the optician's. And he told me that I had sugar diabetes. Then I went to the doctors and had a blood test, and it was diabetes. Then I had to take something called insulin and some other tablets to keep me right. And then I realised that I'd caused it myself by eating the wrong things, by not exercising properly, and I just wanted to let other people know that try and get that sort of stuff sorted out if you can before this happens. But if this is happening to you with all these symptoms, go to the doctors, get yourself checked, because you might have diabetes."
Kerry, if a person has any of these symptoms, what can you do about it?
If they have any of the symptoms I've just described, the best thing is to make as quick as possible an appointment to see your doctor or the practice nurse, and you can go in and explain how you're feeling. It's all private, confidential, no one else needs to know you've been, and a few simple tests would usually pick up whether you had diabetes or not. And by simple tests I would mean something like a blood test, a urine test, and if you are diagnosed as diabetic, then with the support of the team around you, having regular checkups, looking after yourself with a healthy lifestyle, stop smoking, good eating, then a lot of the symptoms and complications we've described today can be lowered and reduced and improve your health. But it's all about going for those checkups and getting yourself seen as soon as possible.
Move along, move along. You don't belong. Move along. That TV show suits your point of view. It makes you laugh, it makes us look like fools. You get high on
Depression is a big thing amongst travellers, but nobody wants to talk about it. So why are you putting it on your DVD now?
I'm putting depression on my DVD now because I need to get it over to people what it can do to you. depression hits you without you ever knowing it's hit you. And a friend of mine is going to speak about depression, and he must be the first travelling man I know that has done it. We have the highest suicide rate amongst ethnic communities, amongst travellers, and we need to bring depression out. We need to understand it and what it can do to you. It's not just a matter of being a miserable day or your football team's lost. That's not depression. People who suffer from depression will be able to tell you really what depression's about. And this is what I'm hoping to get across to everyone. Paul, can you tell me what is depression?
Well, depression it's a range of symptoms, but essentially it's when people start to feel really low in mood. I guess we need to make sure that we don't get confused with the sort of everyday sort of ups and downs in life, which we all have, and that's perfectly natural. But there are times when things start to get on top of us, and perhaps we start withdrawing into ourselves, start getting worried and anxious. And there are a number of other symptoms that we might start to become aware of.
Can you tell me what it's like to feel this depression?
It's a hard thing to describe, I think. It's a hard thing to understand unless you've been through it yourself. It's just this horrible feeling of pressure, of like just a big weight. Everything feels harder than it should do.
And when did you start to feel this depression?
I think again that's quite a difficult one to say at what point it was depression and at what point it was just the normal pressures. I mean, you're kind of brought into a world where you're made to have these things. You know, there's the pressure you get in your vehicles. You haven't got a job to go to every day that's just a normal sort of 9 to 5 job. It's a different way of life. So you've got that pressure on you from the day you're born. So knowing at what point those pressures became depression, I think is a really difficult thing to sort of point at and say it was that day.
Can you tell me what it was like for you when it got really bad?
I think it's at its worst was probably not long before actually I first spoke to somebody, which was hard. The knock-on effect it had to everything I was doing was I suppose it started probably for me with money pressures. And there was a certain sense of sort of pride that meant I didn't want to talk to the family about it, so I kept it to myself, which made things worse. And obviously really what I needed was to talk to the family. They needed to know where I was, but I didn't want my kids to see me as weak. I didn't want my wife to see me as weak. I didn't want any of my friends to know about it, so I just kept it to myself. And then you get to a point where it's just sort of spiraled and you can't see how you're going to change anything, how anything's going to be any different. And then you start shooting yourself away even further. It's the more I wanted to talk to them, the less I wanted to be around them. So I sort of pushed everyone away and started doing some stupid stuff, really stupid things. I mean, there were points where I was probably getting through like a bottle of vodka a day. Weeks where I wasn't really talking to anyone. Anytime anyone was around me, all it was just another fight. It's just another argument. And then I'd just disappear. Sometimes days on end, people might think, you go for a walk and have a think. I'd go for a drive, and I'd just drive. Days away. Just, no bearing on time at all. Did no idea where I was actually going. I was just driving. And then you got to the really hard stuff where you're looking at the flyover bridges you're thinking, how fast would I need to hit that for it to all end?
Paul, can you tell me what kind of help you can get for depression?
Well, there's a range of help that's available, but it might be worth speaking to your family or your close friends first if you're feeling low in mood. That might be difficult for some people, so the other option would be to make an appointment with your GP and go and have a chat with them and explain exactly how you feel. One of the advantages with going to your GP is obviously they've got to keep that information confidential, so they're not going to speak to your family or your friends. They may suggest that you should let them know how you're feeling, but at least you know you've been able to share your thoughts and your feelings with them, and then they can they may decide that they can manage your depression within the GP surgery, or they may feel that you need to be referred on to a specialist service or somebody who could provide counselling. And there are other organisations, voluntary organisations, that can provide help and support, which your GP should be aware of and may be able to point you in the right direction.
So when you realised it was getting bad, what did you do about it?
This is the bit where I think I didn't do what I'm hoping people that will watch this will do, and that was go and get some help. I literally had to wait to the point where I tried to tell myself, and well, obviously I didn't succeed, but it was in the hospital that obviously it was pretty clear at that point there was something wrong, and so they got me to start talking to people, and it was the very first conversation. I remember the very first conversation with the first doctor, and one of the first things I was saying about was not wanting anyone to know I was there, and he had this really, I remember it was really short, literally he probably said something 5-6 seconds about their doctor's confidentiality, and I suddenly realised that all those years of not talking to someone, I kind of just felt a bit stupid, really, that there was that opportunity was there all along and I hadn't taken it. So for me, it was how I'm still here, I don't know.
And has it helped you over the time, over this last few years?
Yeah, absolutely. I mean, a few years ago, I wasn't what I am now. I was a totally different person. Even at the time when we were going through it, I started getting, they gave me medications, so they gave me some antidepressants, and it did help. I mean, it really helped. The days I started feeling like me. The days started feeling a bit more normal. I felt like I could get up and do things. I was getting back to being more like myself, and family was seeing that straight away. To begin with, I still wasn't 100% open with them. They didn't really know that's what it was, and then over time, I've been able to start to reduce the amount of the medication that I'm having. And now my family know, everyone's aware of the situation, and things are just, well, they're 100% better.
So you would recommend anybody to go to the doctors?
Just go and talk to someone, especially if you're feeling like I was and you didn't want people to know. Well, that's the great thing about it, is they're not going to tell anyone. If anything, they're not allowed to tell anyone. So yeah, just if you need it, go and speak to someone.
Move along. Move along, you don't belong. Move along.
I hope you've enjoyed the video, and I hope you've learned something from it. I've learned something. I've learned quite a few things. And you must go to the doctor if any of these symptoms are showing up. Even if they're wrong, even if it's wrong, you go. It's all confidential. You have no worries about them telling anybody anything. And it's looking after Mandy. That's the name of the game. We have to do that because we've got to look after our family. If anything happens to you, me, any of us travellers, there's no one left to look after our sons, daughters, wives. And this is what this video is trying to do. It's trying to put you wide on everything we can.
We just pulled in on the edge of town. You don't know us, you want to put us down. You don't like our ways, you don't like our turn of phrase. You sure know how to show we don't belong. Move along. Move along, you don't belong. Move along. That TV show suits your point of view. It makes you laugh, it makes us look like fools. You get high on all that hype. You seem to need that stereotype. You think you've got it right, but you've got it wrong. Move along. Move along. You don't belong. Move along. We're just flesh and bone. These souls landed on, just like a tune lands upon a song. We're not your enemy. I could be you,
You could be me.
there's strength in diversity, so keep it strong. Move along. Move along. You don't belong. Move along. You want to bed us down in cold concrete. You are just one paycheck from the streets. Our roof is the sky. Our walls are mountain high. Our floor the earth and the roads we travel on. Move along. Move along. You don't belong. Move along. Move along.